I'm Paige Hopkins. I'm here with Dr. Scot Glasberg, the incoming president of the American Society of Plastic Surgeons. Welcome.
Thank you for having me.
What are some key things a consumer can do to ensure they get a good plastic surgeon?
Number one is they need to find a board-certified plastic surgeon, one that's actually certified by the American Board of Plastic Surgery. That means that the surgeon is trained in a specific way, has been tested through a series of tests, both written and oral, and that ensures that that surgeon is the most expert person to do that surgery. The other key factor for them when they go to get surgery is to make sure they're being operated on in an accredited facility. Accreditation means that the facility that they're operating in, be it a hospital or an office or maybe an ambulatory surgery center, has passed all the safety accreditation standards for that facility. At the American Society of Plastic Surgeons, all of our members are board certified and all of them are required to operate in accredited facilities.
What do you think that plastic surgeons can do to ensure safety in the industry? Because there's so much bad plastic surgery out there.
Well, from a personal standpoint, I always tell my patients subtle is best. And patients don't understand that right away when they come in. They think more is best. And I have to show them pictures, and I actually meet with every patient twice before they go to surgery to help them understand what realistic expectations are and what too much plastic surgery can be. You want to make sure that the patient is doing plastic surgery to feel better about themselves. It's a body image thing. So you want to make sure that there's all of that. You also don't want them to think that this is going to be a life-changing event. That's not what we want as plastic surgeons. We want people that are going to feel better, feel refreshed, look younger, and that's the result that we want.
Okay, on to the good news. What are some of the exciting developments right now in plastic surgery, the trends, where you see the most growth?
Well, I think plastic surgery in general is a pretty exciting field because it's very diverse. What we do runs the spectrum of procedures, head to toe, different parts of the body. You know, most of us who got into this field got into it for that reason, but we always seem to be on the cutting edge of a new technology that we're looking at. And right now, the most fascinating is fat grafting.
Fat grafting.
Literally taking fat from one part of your body, and the fat that we maybe used to discard as part of a liposuction procedure, processing it a bit in the operating room, and then placing it in another part of the body. It could be in the face. The most exciting area right now is probably in the breast, in reconstructive breast surgery, where we'll use this fat to help build up a breast to make it look more natural, more real, even feel better than it used to feel with an implant alone. We haven't gotten to the point of replacing an implant yet.
Yeah.
That's probably down the line. We're probably 10 or 15 years away from that. But using it in combination, you know, implants have some issues too, and we're able to mask them with the fat grafting that we're using right now.
How do you think that the partnership between ITN, Lincoln Square Productions, and the ASPS will bring to light major issues in plastic surgery?
Well, we're really excited at the American Society of Plastic Surgeons about the relationship. There's some myths out there about plastic surgeons, and it's in the public, and sometimes it's in the media, and even when I go to Capitol Hill, let's say, and meet with a legislator, they think that all we do is cosmetic surgery.
Yes.
And the reality is, me personally, I do 50% reconstructive and 50% cosmetic, and my colleagues, the members of the American Society of Plastic Surgeons, 85% of them are at least doing some element of reconstructive surgery.
Wow.
So we can help dispel the myths of what's out there in terms of what plastic surgeons are actually doing. The other thing, which I think, is showing that we're actually a big part of the healthcare team. And the best example that I can use is in breast reconstruction surgery. I'm only one element of a large breast cancer team. There's the breast surgeon, the plastic surgeon, the oncologist, the radiologist, the pathologist, the radiation oncologist, the nurse practitioner. There's a whole litany of people in this breast cancer team, and we're part of it. And it's not just there, it's all the different facets of what we do. We're part of a sort of team that works together with other paraprofessionals, other specialties as well. The last thing is you don't meet your plastic surgeon just once. Plastic surgeons sort of, we'd like to live with you through the spectrum of your aging. You know, it's nice to walk in and want one procedure, but the best patients that I have, the happiest patients that I have, are the ones who know me for a long time.
Well, this has been so informative. Dr. Glasberg, thank you so much.
Thank you so much for having me.
And we are excited to be partnering with ASPS to bring to light the major themes of plastic surgery and to tell the story of this industry as it should be told.